Assalamualaikum and a very good day to Professor Madya Dr. Mohd Hafez Mohd Isa. My name is Fatimah Azzahra binti Saupi and my matric number is 1170870. Today, I will be presenting on nuclear medicine, specifically for SPECT and PET. Basically, in this video, there are 6 main components, which are, the first one is Introduction to Nuclear Medicine, which I will explain what is actually the nuclear medicine, and then I will explain briefly about SPECT, followed by PET, how it works and the principles, and then the fourth one is the research, what people or companies are interested in doing this research, and followed by the future goals, what is the ultimate goal in the future, and last one is the conclusions, how it give impact to the future. Nuclear medicines. It sounds scary, right? I mean, the same nuclear that you find in nuclear reactors and nuclear weapons. And it does make use of the same atomic processes. Nuclear medicine is actually safe, and it is an effective way in diagnosing and treating a wide range of conditions as a diagnostic tool. It takes a form of radioactive chemicals that called radionuclides. Then the radionuclides will combine with the molecules in human body, and this combination called tracers. Tracers can be administered orally or intravenously. These tracers tend to migrate towards infected organs, like tumors or infected bones, and they are giving off a signal that can be detected outside the body. For example, a doctor wants to diagnose disease in patient's lung, so she inserts appropriate tracer and then she uses gamma ray to detect radioactivity and take photograph of patient. Gamma camera are able to move around and take photographs at different angles, and then it will show the tracer accumulated in organ and give valuable information for diagnosing conditions in 3D model. All of these are very useful for diagnostic data, and it can be used to treat diseases, for example thyroid cancer and blood disorder. However, nuclear medicine is a strong stuff, so many experts has established a stringent code for minimize the risk of exposure towards radioactivity by using ALARP. ALARP is stand for as low as reasonable practicable, by means that the patient are given as small an amount of radionuclide as possible, as long as it is still useful enough to provide a useful diagnostic clinical results. Gamma radiation specifically used for diagnostic. It travels pretty far, just it can pass through the body and reach the cameras. However, different from therapy, nuclear medicine therapy, it uses ionizing radiation, which is much stronger. It absorbed by body tissue and treat the problem area without harming the nearby organs. Therefore, we can see how tiny atoms can give big difference towards human health. Okay guys, now let's start with SPECT scan. SPECT scan, or stand for Single Photon Emission Computed Tomography, lets your doctor analyze the function of some internal organs. A SPECT scan is a type of nuclear imaging test, which means it uses a radioactive substance and a spatial camera to create a 3D image. While imaging tests such as X-ray can show what the structure inside your body look like, a SPECT scan produces images that show how your organs work. For instance, a SPECT scan shows how blood flows to your heart or what areas of your brain are more active or less active. The most common use of SPECT are help to diagnose or monitor brain disorder. Some parts of the brain are being affected by dementia, clogged blood vessels, epilepsy, and head injuries. Secondly, it can monitor heart problems, where SPECT can check the clogged coronary arteries and reduce pumping efficiency. Area of bone healing or cancer progression usually lights up on SPECT scans. So this type of test is being used more frequently to help diagnose hidden bone fractures. SPECT scan can also diagnose and track the progression of cancer that has spread to the bones. So for most people, SPECT scans are safe. If you receive an injection or infusion of radioactive tracer, you may experience bleeding, pain, or swelling where the needle was inserted in your arm. Rarely, an allergy reaction to the radioactive tracer SPECT scans are safe for women who are pregnant or breastfeeding because the radioactive tracer may be passed to the developing fetus or the nursing baby. The doctor used a small amount of radiation in order to perform a SPECT scan, and the test is not associated with any long-term health risks. And now let's continue with PET scan. In nuclear medicine, PET scan, positron emission tomography, used to obtain images of the brain activity rather than its structure itself. It creates a 3D images of the body. It does this by using radioactive traces, which are usually administered to patient's body through invention injection. The traces are made up of carrier molecules that are tightly bonded to a radioactive atom called an isotope. The carrier molecule can interact with or bind to a specific protein or sugar in the body. The carrier molecule that will be used depends on what the doctor are looking for. For example, if the doctor suspects cancer or is monitoring a known cancer's growth, she may use FDG, which is a modified form of glucose, which gets absorbed by tissue. When tissues are absorbed a lot of glucose, it may indicate a cancerous tumor. The radiation from the traces pose little danger to the patient since they quickly pass out of the body. The isotope produces small particles which called positrons, which interact with the surrounding of electrons. The interaction results in the complete annihilation of both particles, releasing two photons that split off in the opposite direction. And the detectors in the PET scanner measure these photons and use this information to create the image of the distribution of FDG in the body. Many researchers have done various of studies on PET and SPECT scan application, and one of the study is diagnosis of neural crest and adrenal tumors. Neural crest and adrenal tumor, these are the disease or tumor that is come from the pheochromocytomas and paraglioma cells, which are neuroendocrine tumor that arise at junction of neural tube and the dorsal ectoderm in endocrine system. As you can see from the diagram below, the location of the crest and adrenal gland, so there is where the location of this tumor arise, which is from within the adrenal gland and the crest. This tumor can be detected or can be localized by using MIBG, which is radioiodinated meta-iodobenzyl guanide. It is the first radionuclide that is capable on specifically depicting and localizing paraglioma secreting tumor, which is this MIBG can locate it where is actually the paraglioma secreting tumor. Nowadays, this MIBG scintigraphy still regarded as first choice imaging technique for diagnosis of neural crest and adrenal tumor. However, in clinical utility, there is lack of accuracy in detecting this disease. Therefore, the combination of anatomical maps and scintigraphy image by using SPET CT, which allowed this significant improvement. From the diagram, you can see IMIBG image scintigraphy at the left and SPECT CT scan image at the right. From the left, it is the image of the whole body planar scan that shows multiple foci of tracer uptake in the abdominal area, that most notably in the navel and in other areas suggesting possible lymph node occur. And then at the right side, that is the image of the SPECT CT scan, shows that the such foci represent perinotial implant rather than visceral or lymph node metastasis, which show the more specific localized where is actually the node metastasis occur. From research of clinical application of SPECT CT scan new hybrid nuclear medicine imaging system, Azzahra et al. Has explored the role of the SPECT CT scan imaging for MIBG scintigraphy in 31 of patients with suspected of pheochromocytoma cells. And from this research, the results shows that 81% of cases fuse images correctly characterize focal tracer accumulation uptake detected. And by this, we can say that MIBG scintigraphy very useful not only for identifying primary tumors but also monitor the pattern of metastatic spread with overall of 92% sensitivity and 96% specificity and respond to the treatment. That's why we can say that this MIBG scintigraphic is still can be very useful in clinical diagnosis nowadays. But by using SPE CT scan image will further improve its diagnostic accuracy. Another research has been done in comparing which one is better in evaluation of neural crest tumors, either by using GA.TATE PET CT scan or by using 131I MIBG CT scan. And from this research, it can be concluded that 68GA.TATE positron emission tomography PET CT scan shown promising results in imaging of neural crest tumors compared to IMIBG SPECT CT scan. By referring to radiological imaging and histopathological findings as reference standard, 68GA.TATE shown a sensitivity of 100% and 96% of accuracy compared to 131 IMIBG scan, which show sensitivity of 86.7% and 88% of accuracy on a per patient basis. Diagram A shows the 131 IMIBG scintigraphy image, while diagram G shows the 68GA.TATE PET CT scan image. So it can be said that diagram G has clearer image compared to diagram A. From the research, PET imaging technique and radio labeling of somatostatin analog with positron emitting isotopes including 68GA, 68GA.TATE PET scan has demonstrated dramatic improvement of the spatial resolution and lesion detectability compared to MIBG scintigraphy. Based on cumulative official and clinical experience, MIBG is still considered as the workhorse in evaluation of NCT. A potential drawback of 68GA.TATE PET imaging could be the high cost of 68GE or 68GA generators. However, in recent approval of the SST analog kit by the United States Food and Drug Administration, along with the increasing demand of 68GA labeled radio tracers, will make 68GE or 68GA generators more readily available. In addition, imaging centralization and a referral system as example of an effective systematic planning would help reduce the cost of 68GA imaging. So from that, we can produce 68GA commercially. For the future goals of this SPECT and PET in nuclear medicine, firstly, the first technology is combined PET CT and SPET CT scan scanners for breast imaging cancer diagnosis. Because nowadays, the breast imaging for cancer diagnosis is still mainly based on 2D imaging techniques. Therefore, some research come out with the idea of combined PET CT and SPECT CT scan. The second one is the future success of PET may be grounded in its inherently better image resolution, which means that PET superior diagnostic capability is achieved partly through advance in hardware, particularly quantification, which leverage numerical precision to identify global perfusion defects in the heart that otherwise might be hidden from qualitative SPECT scans. And then by using UltraSPECT, which is the new iterative reconstruction IR software, such as UltraSPECT is improving SPECT image quality by boosting the signal to noise ratio. Just as for CT scans, IR can also help reduce those by enhancing lower quality scans. And then the last one, by development of new tracers for both SPECT and PET scans. Last but not least, we can conclude that SPECT and PET scans are very useful in diagnosis and nuclear medicine as an effective way in application of radioactive substance in treatment and diagnosis of various diseases and cancers. Hopefully you guys gain something from this video, and thanks for watching. Bye and Assalamualaikum.